You already mentioned Denmark case. What happened in Ireland?
Ireland has a lot of pharmaceutical industry there. And so there was a very big push to have children be vaccinated, and the vaccines were being given in the schools. And there were kids who were having severe adverse reactions to the shots. And so again, there were protests by parents with these children. And one girl in particular we describe in the book, she was limited to a wheelchair after her vaccine injuries. And she basically called out some of these people. I actually went to Ireland to a conference, and some of the other people who were the scientists, doctors who were speaking out about HPV vaccines came to that conference. And again, not quite sure how much is happening, but many of the countries that adopted HPV vaccines, there's been huge pushback. France, for instance, there was an episode in the last year or two where a young man was vaccinated in school. He fell and hit his head. These shots are dangerous, Andrea, and there's no proof that this prevents cancer. There's absolutely proof that these shots can severely injure and kill people. There is no basis for there to be a mandate for this. Absolutely none. They are not safe. They are not effective. And I know that the Croatian people have stood up against forced medicine in the past. And I would definitely urge them that this is another one that is absolutely worth standing up to, because this is a vaccine that is not safe and it's not effective.
That's why it's important for them to hear you and to read this book. But let's explain it later. There is in Colombia, families were organized there and fight against this vaccine.
So Colombia was very interesting. We worked with some journalists and others, lawyers in Colombia. So again, they were rolling it out in the schools. And Colombia actually had laws against forced medicine, but they were using it again in kind of remote areas for large groups of children. And many of these children all at once would have these severe adverse effects. They couldn't walk. They would have jerking motions. They would be really adversely affected. And so literally parents chained the entrance to the school so that the kids would not be able to get in. And litigation proceeded to the highest court in Colombia. And the court did uphold that there can't be a mandate for these shots.
But we have also one example of Australia. Why did Australia get in this vaccinating early and broadly?
So one of the key inventors of the technology that goes into the HPV vaccine is a scientist named Ian Fraser. He's originally from Scotland, but he lives in Australia. And there's a big pharmaceutical industry in Australia. And in theory, they said that this vaccine was to protect women in the developing world. And women in the developing world are absolutely at greater risk of cervical cancer for many reasons. There's not the same kind of screening. There's more toxic exposure, especially smoke within a house for cooking. But that's not really where they've sold this shot. And in Australia, there was this tremendous pride that their own had been a co-inventor of the shot. So there has been high uptake. There's been alleged science out of Australia about the proof that it's diminishing cervical cancer. I believe that you'll have on a Croatian scientist, Lucia Tomljenovic, who will explain that that is very dubious science. There's really no proof. And in fact, some very important French physicians, the Delapines, have done data suggesting that the rates of cervical cancer have actually increased after the initiation of the HPV vaccines. And I think that's for several reasons. It's in part because the vaccines are probably causing cancer. We know that can happen from the clinical trials, but it's also because basically the screening that was happening, the PAP screening, has stopped. Also, these shots do not prevent all types of cervical cancer or all types of human papilloma induced cancer. So there's over 200 different types of human papilloma viruses. This targets 9, and not all of them are even targeting cancer causing viruses. Some of them are targeting herpes kind of lesion type of viruses. So this is really just, it's all about the marketing, Andrea. It's billions of dollars. Our book covers, literally the pharmaceutical press talked about this as lightning in a bottle, making a market out of thin air. This is all about the initial marketing campaign in the United States was have your daughter be one less. And as one of the scientists who worked in the clinical trial said, your daughter was never going to be somebody who was going to get cervical cancer anyway. Cervical cancer is not a major cancer in the United States because there was effective screening, and nutrition, sanitation, and other things basically made it not a highly prevalent cancer.